I told you when blood is not available, that time, if the blood is not ready and then the cross-matching is not done, that time we will use the plasma expander, isn't it? So here this plasma expander is, this is designed to provide the full colloidal osmotic pressure so that whenever this volume will be less, then the heart has to pump more and more for the blood supply to this vital organs, isn't it? So that's why we'll use the plasma expander. And then under the plasma expander, mute your mic, please. So under the plasma expander, there are the two type of solutions are there, and one is the colloidal solution and another one is the crystalloid solution. Oh, sorry, I forgot to record the slide. I'll just record first.
It is being recorded.
Yeah, how? I didn't press it, but okay, fine then. Oh, you people know everything. Okay. So now there are the two types of solution. One is the colloidal solution and another one is the crystalloid solution. So the colloidal solutions are those which will remain in the blood vessels for the more duration of time, and crystalloid solutions are those which will be there in the blood vessels for a short duration of time. Understood here? So if colloidal solution is not there, so we have to give the crystalloid, isn't it? So here under the colloidal solutions, dextran 40 is there, which I already told you, dextran 70 is there, and then the hydroxyethyl starch 450, and then the gelatin. So if you remember one or two names, that's fine, or if you don't remember the names, at least you should be able to tell the colloidal solution and then the crystalloid solution. When we will be asking, okay, when blood is not available, what will you give that time? So under crystalloid solutions, lactate is there, and then the 9% sodium chloride, or you must have heard the saline water, isn't it? So it will be used. So saline water means 0.9% of the sodium chloride is used. So now we'll come to the indications of the blood transfusion. So it can be divided according to the, one is the whole blood transfusion is there, another one is the packed red cell transfusion is there, one is the granulocyte transfusion is there, platelet transfusion, irradiated blood transfusion, and then the cryoprecipitate transfusion is there. So blood transfusion can be divided according to that one. So whole blood transfusion, whole blood means whenever the blood is taken and then it is not separated into the different components like the platelet, plasma, and then RBCs, it is not separated. That time we call it whole blood transfusion. And packed red cell, yesterday I told you, isn't it? So packed red cell means whenever like 70 to 80% of the plasma is removed, then it becomes the packed red cell. So granulocyte transfusion means in case of this what do you say, hypoplastic, this one bone marrow where there will be no granulocyte, this one, or in case of the neutropenia, we will transfuse the granulocyte transfusion. And platelet transfusion, many this are there, DIC is there, and other bleeding conditions are there. And irradiated blood, irradiated blood means whenever the blood with this ultraviolet rays, it is scanned, and then this will do irradiated blood we can give in case of the immunocompromised patient. So immunocompromised patients, so they don't have much immunity to fight against the infections, isn't it? So in those cases we can give the irradiated blood transfusion. Means with the help of the radiation we can kill the other whatever unnecessary things, organisms and all. So that we will give the irradiated blood transfusion. And cryoprecipitate transfusion, I told you what do you mean by cryoprecipitate, and then it is very less in amount. So usually we'll give in case of the this factor 8 and then the factor 9 deficiency. So we'll come to the whole blood transfusion. So now you see here indications for the first line, you can see indications for the whole blood transfusion. So here we can give this whole blood, means RBC is also there, platelet is also there, plasma is there, and it is not separated. So we can give this whole blood in case of the actively bleeding patient with blood loss greater than 25%. Understood here? So that time we will give. So if a person is doing surgery and then he's actively bleeding, or in case of the road traffic accident or the railway traffic accident, if a person is bleeding heavily, that time we'll give this whole blood transfusion. Now the next one is the exchange transfusion. Exchange transfusion means, so exchange transfusion can be done in case of the newborn also. Sometimes in case of the newborn also we can do exchange transfusion, and sometimes in case of whenever this malarial or this parasitic load is more in a person, that time his blood will be removed from the body whenever the parasitic load, like in case of the malaria and all. So whenever parasite will be more in the RBCs, that time we will remove the person's blood and then we will give the whole, we'll transfuse the whole blood. So that is known as the exchange transfusion. For doing the exchange transfusion, the blood, I told, how many days we can store the blood? Anyone?
5 weeks.
Good, 5 weeks, isn't it? So here for exchange transfusion, we have to give the blood, like if it is required, then we'll give the fresh blood. If it is fresh blood is not there, we have to give the blood which is stored for less than 5 days. Understood here? So now we'll come to the indications for the packed red cell transfusion. Packed red cell, I already told you how it is prepared, isn't it? So packed red cells means mainly the RBCs are there. So here, mainly RBCs, what's the use then? We'll give it in case of the thalassemia measure. Thalassemia you must have studied, and sickle cell anemia, also aplastic anemia, and severe anemia of any cause, or sometimes in case of the surgery also we can give. Understood here? So packed red cells we can give in thalassemia measure, sickle cell anemia, aplastic anemia, severe anemia of any cause. Means whenever there is the anemia, severe anemia is there. Anemia means the hemoglobin is not there or the RBC not there, isn't it? So we can give in case of the severe anemia and also in case of the surgery. This slide is clear? So now we'll come to the indications for the granulocyte transfusion. So this granulocyte transfusion is not done usually, and it is very rare, but still we should know when we should give this granulocyte transfusion, isn't it? So now whenever the bone marrow is showing the myeloid hypoplasia, means the myeloid cells will produce what type of cells? Anyone? In anemia or in that neutrophils, lymphocytes, all these, isn't myeloid cells is for the mainly neutrophil, isn't it? So neutrophil will be there, and eosinophil, and then this will also be there under the myeloid cells, isn't it? So now here, whenever this bone marrow is showing the myeloid hypoplasia means now the myeloid cells are not forming. That's why we'll give the granulocyte transfusion. And now in case of the neutropenia, whenever this neutropenia is less than 500, PMN means polymorphonuclear neutrophil. So whenever this neutropenia is there and less than 500, so the infection can be there, isn't it? So that person can have the infections. So that time we can give the granulocyte transfusion. So other indications are also there, but here only you should know that myeloid hypoplasia means myeloid cells from the bone marrow, it is not forming. And then we'll give in case of the neutropenia. Neutropenia, it can be there of the various regions. So just know the neutropenia, less than 500 neutrophils per microliter. Now we'll come to the indications for the platelet transfusion. So now platelet, when we should give here. So we can give the platelet in case of the non-bleeding patients with a failure of the platelet production. So here the platelet, how much should be the normal platelet? Anybody knows?
1,50,000 to 4,50,000.
It is 1,20,000 to 4 lakhs. Okay. So you are right only, but I didn't hear you properly. So 1,20,000 to 4 lakhs, it is considered as adequate. So now here, in case of the non-bleeding, the patient is not bleeding, but there is the failure for the production of the platelet. And now here the platelet has become less than 20,000 per microliter. So here, if the platelet is less than 20,000, usually whenever we will do the bone marrow, if the platelet is less than 20,000, there can be any chance of bleeding. So we will not do the bone marrow also. Bone marrow study we will not do. Aspiration or biopsy we will not do. So here the patient is not bleeding, but if his platelet is showing only 20,000, that time we can give the platelet transfusion. So the platelet transfusion means it can be the platelet rich plasma or the platelet concentrate. Understood here? So in case of the DIC means you already told me yesterday that it is the disseminated intravascular coagulation. And so DIC patient will bleed heavily, isn't it? So there the coagulation system will also be activated. Two systems will be activated at the same time. One is the coagulation system and another one is the fibrinolytic system. So blood is also clotting at the same time, and then it is also this lysis is also occurring. So in case of the DIC, we can give the platelet transfusion whenever in those patients if the platelet is less than 50,000. Understood here? So we can give in case of the active bleeding case also, and whenever the platelet function defect. So in platelet function defect means, so platelet is there in that persons or in those persons, but the platelet is not working its function. Understood here? So it is not doing its function. That's why whenever there is a platelet function defect is there, that time also we can give the platelets. Understood here? So granulocyte, in case of the myeloid hypoplasia, whenever neutropenia is there, neutropenia means less than 500 neutrophils per micromilliliter, and platelet transfusion can be given in case if a patient is not bleeding but still in his body or in his blood, if the platelet is less than 20,000. And in case of the DIC, disseminated intravascular coagulation, less than 50,000. And also in case of the active bleeding cases and platelet function defect. Here the platelets are normal. If count is like, it may be 1,40,000 or it may be 2,50,000, but still the platelet will not function. So that time also we can give the platelet transfusion. So now we'll come to the indications for the irradiated blood transfusion. So irradiated means, I told you, with the help of this ultraviolet rays, the blood is irradiated. And so here this irradiated blood transfusion can be given in case of the congenital immunodeficiency syndrome. So here this person is immune deficiency is there, and it is not because of the acquired reason, but here it is there from since birth, isn't it? So here the platelets patients with the congenital immunodeficiency syndromes are having this, so they can be prone for infection. So we'll give that time whenever the blood transfusion is required, that time we'll give irradiated blood transfusion. And also in case of the bone marrow transplant recipients, so whenever the bone marrow transplantation is done, that time we will give the irradiated blood transfusion. And also in case of the premature newborn babies. So the premature newborn babies, their immune system will not be very strong. So here in case of the premature newborn babies, their immune system is not strong. That's why we'll give the irradiated blood transfusion. Understood here? So now we'll see the indications from the cryoprecipitate transfusion. Cryoprecipitate, I told you yesterday how it is made. So we can give in case of the hemophilia A, in case of the von Willebrand disease, and in case of the congenital or the acquired fibrinogen disease. So here this cryoprecipitate will give in case of this. We can give in also in case of the hemophilia B also. So here or the Christmas disease, because here only one I have written, but still you can say hemophilia A, hemophilia B, and then von Willebrand disease, because von Willebrand disease means here the von Willebrand factor will be deficiency, isn't it? So in that case also we can give. So I'll repeat the slide once again. So irradiated blood, it can be given in case of the congenital immunodeficiency syndrome, bone marrow transplant recipients, and in case of the premature newborns. So now cryoprecipitate we can give in case of the hemophilia A, hemophilia B, and then von Willebrand disease, congenital or the acquired fibrinogen disease. This slide is clear. Did you understand?
Yes, ma'am.
Okay. Now we will come to the donor selection. So the donor selection means, so when person can donate the blood. Understood here? So donor selection means suppose which person, and then the what type of persons can give blood, which disease having person cannot give blood. So under this everything comes here. So for the donor selection, age has to be 16 to 60 years, or sorry, 18 to 60 years. So for the donor selection, the age of the person has to be, so somebody can donate on their 18th birthday also. 18 years to 60 years one can donate the blood. And then how many times they can donate the blood? Healthy male, they can donate the blood in every 3 months. and female in every 6 months. Understood here? So male, they can donate every 3 months, but for the females, they can donate every 6 months. So the female should not donate blood during the menstruation, pregnancy, and lactation. So during menstruation, bleeding loss, blood loss will be there. That's why they should not donate that time. And in case of the pregnancy, also the within the utero, the fetus is growing. That's why that time they should not give blood. And in case of the lactation, lactating mothers also, they should not donate the blood. So for donating the blood, hemoglobin, it has to be more than 12.5 gram per deciliter. Understood here? So usually hemoglobin, it has to be more than 12.5 gram per deciliter. So you must be thinking how to know that whether the person's hemoglobin is 12.5 gram deciliter or not, isn't it so? So in this case, we will do in those persons, if a person is looking anemic and he or she comes for blood donation, that time we will think that, and we'll ask for this hemoglobin estimation. So we'll ask for to do the hemoglobin, and if it is less than 12.5 gram, we will not take blood from that donor. So here, if the hemoglobin is less, why we are not taking blood? Did you understand here? Because we are giving this blood to a person who is sick and then who is not having this this hemoglobin proper, isn't it? So to the sick person only we will donate the blood. So here, that's why the hemoglobin, it has to be more than 12.5 gram per deciliter. And weight, so here it is written 50 kg. Now recently WHO or this blood camp, they have made more than 45. So if a person is more than 45 kg, then he can donate the blood 350 ml. And then if a person is more than 50 kg, that person can donate 450 ml. If a blood is donated 350 ml, it will be used as a whole blood. But if a person can or will donate 450 ml of the blood, that time we can make it in a different components. So age 18 to 16 years, person has to be more than 18, and then the less than 60 years. Sometimes during the blood donation camp, some donors, they will come and then they will say that and if they look very young, then we'll ask their age, what's your age? Then that time they will say that 16 years old. Then whenever we will tell them that, okay, you cannot donate blood, then that time they will say, I have donated last time. So maybe whenever there is so much crowd in the blood donation camp, that time they may not ask. So one should donate the blood after the 18 years and then till 60 years if the patient is or the person is healthy. So male can donate every 3 months, and then the female every 6 months. And females should not donate the blood during menstruation, pregnancy, and lactation. And hemoglobin, it has to be more than 12.5 gram per deciliter and weight more than 50 kg. So now you see here, in case of the transmission disease or the transmittable diseases, so that time also we should not take the blood. Though these persons are those persons who are having a history of suffered from or been in contact, or these persons who are having a history of hepatitis, syphilis, malaria, HIV, or they are in contact with these transmissible diseases like hepatitis, syphilis, malaria, HIV. So that time we should not take blood from these persons. Understood here? So whenever these transmissible diseases or transmission diseases are there, either the person is having or they are in contact with these persons. So the diseases are hepatitis, syphilis, malaria, HIV. So that time the person cannot donate the blood. So whenever the donor is vaccinated against polio, okay, if a person is vaccinated against polio and yellow fever, measles, smallpox, then they cannot donate the blood for 3 weeks. So it's not good to donate the blood within 3 weeks. Understood here? So polio is usually given to the small kids, isn't it so? So donor, if it is vaccinated against polio and yellow fever, have you heard of this yellow fever? It's mainly, yellow fever is mainly there in the African countries. So, and measles, smallpox, they cannot donate within 3 weeks. So the donor with an animal bite or the anti-rabies vaccine. So if some animal like a cat, mouse, or the dog bite is there, or if a person is taking anti-rabies vaccines or the hepatitis B immunoglobulin, so we should not take the blood from these persons for 1 year. So there are so many things. So everybody cannot donate the blood every time. So we'll ask all these questions and then we'll select the best donor. So with animal bite, anti-rabies vaccine or the hepatitis B immunoglobulin, so one cannot donate the blood for 1 year. So this slide you understood?
Yes, sir.
Okay. So now it's here in a chart. 1 second, okay. I'll just see the attendance. So now here there are different conditions are there, and then the period of deferment means here means till what time the patient cannot donate the blood. Understood here? So abortions. So if a person has aborted, so that time that person cannot give the blood for 6 months. And if there is history of blood transfusion, if the person has received the blood transfusion, so that person also cannot donate the blood for 6 months. Understood here? So in case of the alcoholism, if a person has taken alcohol, then we should not take the blood from this alcoholic person also, but till intoxicated. Suppose sometimes the donors will come and then tell that I have worked in blood bank, so I have a lot of these stories are there. In case of the alcoholism, so the patient donor will come and then they will say that they will come around in the evening and then they will say that, okay, at 5 o'clock or 4 o'clock, I drank alcohol or I drank beer. So that time we should not take. Usually till intoxicated means suppose till the effect of the alcohol is gone, that time we should not take the blood. So here in case of the alcoholism, we say 24 hours. Suppose if a person has taken in the evening, then today evening, suppose till next day evening, we should not take the blood. Then only after he doesn't take alcohol, then only we can give the blood. That person can give the blood or we can take the blood. So in case of the minor surgery, suppose minor surgery means suppose some skin stitches given or some mole removed or small surgery. So that time in case of the minor surgery, we will not take the blood for 3 months. And in case of the major surgery, will not take the blood for 6 months. Suppose major surgery means suppose if a person has done any like appendicectomy. Appendicectomy is also a major surgery. Actually, minor surgery means whenever a person is having a local anesthesia. Understood here? So that part, wherever the surgery is done, that part is only this anesthetized. That is known as the minor surgery. And in case of the major surgery means whenever general anesthesia, the person will not know anything. So that time this is known as the major surgery. So the blood should not be, when a person is having major surgery or gone under major surgery, so the blood should not be taken for 6 months. Now, in case of the typhoid, so person, anybody can have this typhoid, isn't it? So in case of the typhoid, 6 months after recovery, means after recovery also 6 months it will take to take the blood. So malaria, if a person is suffering from malaria, so we will not take the blood for 3 months. If somebody is having tattoo, so nowadays tattoo has become a fashion, isn't it? So tattoo, so 6 months we will not take the blood. Understood here? So in case of the acute nephritis, 6 months after recovery. So acute nephritis, so by this time you must be knowing that kidney is related for the RBC production, isn't it? So now in case of the acute nephritis, we will not take blood for 6 months after recovery. Understood here? So I'll repeat the slide once again. So in case of the abortions, we will not take blood or the period of deferment is 6 months. And whenever there is history of blood transfusion, will not take blood for 6 months. And in case of the alcoholism, till the person is intoxicated. So if the person is having signs and symptoms of alcoholism, and if he will say the recent history of this alcoholism, or recently, like within 1 or 2 hours, then that time will not take. Usually here, till it is written till intoxicated, usually we will say that 24 hours. Minor surgery 3 months, major surgery 6 months. In case of the typhoid, 6 months after recovery, and in case of malaria, 3 months. So malaria also, this malarial parasite is there in the RBCs, isn't it? So if that person is having the RBCs, malaria, so that's why in the basic screening test, we did the test for the malaria also. So malaria 3 months, and in case of the tattoo, 6 months. So having tattoo, also 6 months.
Ma'am, why?
Because in case of tattoo, you are asking.
Yes, ma'am.
Okay. Usually you never know where that person is having that tattoo, isn't it? So whether it is done in the under all aseptic precautions or not, you see, and then with the tattoo doing, then there will be some ink will be there, isn't it? So usually if a person does tattoo, there can be the HIV infection or hepatitis infections, that it can be there. That's why tattoo doing the 6 months, we don't take the blood. So we never know that whether the person has done in a very special way, then tattoo can be done locally also, isn't it? So suppose when you go to the sea beaches and all, that time there can be the tattoo also. So that's why we don't take the blood for 6 months. Clear?
Yes, ma'am.
Okay. Now other chart is also there. So here, in case of the breastfeeding female, so in case of the breastfeeding, we will not take the blood for 6 months after delivery. So mother has to give the nutrients to the newborn kid, isn't it? So that's why she's breastfeeding, and then one should not take the blood. Understood here? So breastfeeding means mother cannot give the blood to the, cannot donate the blood. So in case of the breastfeeding, and in case of this pregnancy also, and in case of the menstruation also, will not take blood. So breastfeeding 6 months after delivery. So whenever there will be the immunization, suppose sometimes we will give the immunization, isn't it? So one takes the immunization. So if in case of the immunization for the diphtheria, you know, whooping cough, isn't it? So yes, I think so. Anyway, check. Diphtheria is cough, isn't it? So here diphtheria, tetanus, plague, and then the gamma globulin. So we can will not take the blood for 24 hours. Suppose whenever the signs and symptoms is there, 24 hours after the symptoms free. So in these immunization for the diphtheria, tetanus, plague, and then the gamma globulin, we'll take the blood only 24 hours after the symptom free. If the person has to be symptom free, then only after 24 hours we can take the blood. And in case of the rabies vaccination, I already told you 1 year after the animal bite or rabies vaccination. So only 1 year after whenever person has taken the rabies vaccination, only 1 year after the patient can donate the blood. And also in case of the history of hepatitis and close contact, so one should not take the blood for 6 months. So history of hepatitis is a transmissible disease, isn't it? So mainly there are the different types of hepatitis is there, and then the hepatitis B, C, everything is there. So we will not take the blood for 6 months. And in case of the immunoglobulins, it is for the 12 months. And whenever there is a history of jaundice, it is not accepted at all. So here, in case of the history of jaundice, liver is diseased, isn't it? So now in case of the usually whenever jaundice, it can be because of this cirrhosis also, it can be because of the this one hepatitis also, isn't it? So in case of the jaundice, we will not take the blood. Sometimes some people, they give the history when I was like 2 years, 3 years, I had jaundice, then that time we can consider sometimes, but usually in jaundice we will not take the blood. So I'll repeat this slide once again. Breastfeeding 6 months after delivery or breastfeeding women will not take the blood. And in case of the immunization like diphtheria, tetanus, plague, and gamma globulin, so the person has to be symptoms free 24 hours. And in case of the rabies vaccination, 1 year after bite, means after rabies vaccination means 1 year later only we can take the blood. And in case of the hepatitis and close contact, we will not take the blood for 6 months. And in case of the immunoglobulins, if a person has taken immunoglobulins or vaccinated, so we will not take the blood for 12 months. It is also 1 year. And in case of the jaundice, we will not accept the blood at all. This slide is clear? Did you understand this slide?
Yes, ma'am.
Okay. So here you see there are some causes are there where a person cannot give the blood at all. Understood here? No person shall donate blood, or no blood bank shall receive the blood from persons suffering from any of the following diseases or mentioned below. So now here these persons should not donate the blood at all. And then the blood bank also, if anybody while taking the history they come to know about all these things, they should not take the blood at all. So in these cases these persons cannot donate the blood at all. Suppose one is the cancer. So in case of this neoplasm also, or in case of the malignancy also, the person should not donate the blood. And in case of the heart disease also, suppose if a person is having some, there are different heart diseases are there, isn't it? In case of the heart disease also, person should not donate the blood, because whenever after donating the blood, like 450 ml of the blood will be less, isn't it? So that time whenever the volume less will be there, heart has to pump more blood, isn't it? So that's why we don't take the blood from these heart patients, heart disease patients. So now in case of the abnormal bleeding tendencies, suppose a person is having abnormal bleeding tendencies, like in case of the hemophilia, all these reasons, so these cases also will not take the blood at all. And in case of the unexplained blood weight loss, so unexplained weight loss means suppose the person can have any disease, it may be malignancy also, it may be like any hepatitis also. So in case of the or it may be tuberculosis also. So many causes are there for unexplained weight loss, so that time also will not take blood. So in case of the diabetes, control on insulin or oral drugs. So if a person is diabetic and his insulin is, and the person is on insulin and oral drugs, that time will also not take blood. And in case of the hepatitis B infection, will not take blood. And in case of the chronic nephritis also, will not take blood at all. And in case of the signs and symptoms suggestive of AIDS, so in case of the HIV positive person also will not take blood. And in case of the liver disease persons also, suppose liver disease, there can be anything, isn't it? Hepatitis can be there, cirrhosis can be there, or the carcinoma can be there. So in all these cases will not take the blood, or these persons having these diseases, they should not give blood. So I'll repeat once again this slide. So no person shall donate blood, or no blood bank shall receive the blood from persons suffering from any of the diseases mentioned below. So cancer, heart disease, abnormal bleeding tendencies, unexplained weight loss, diabetes, control on insulin and oral drugs, hepatitis B infection, chronic nephritis, whenever if a person shows signs and symptoms of HIV or the AIDS, and in case of the liver disease, the person should not donate the blood. Or if the blood bank knows any of these histories, they will also not take the blood. Clear? The previous
Yes, ma'am.
Okay. Wait, okay, I'll see once attendance. 93. Now we'll come to the blood transfusion reaction. So have you heard of this blood transfusion reaction? You may not know the detail, but you must have heard blood transfusion reaction, isn't it? So blood transfusion reaction means if a person is given or given blood, or if a person received the blood, that time whenever there will not be the matching of the, or cross matching is not there, or sometimes the weak antibodies will be there, that time the person will have the reaction. So that is known as the blood transfusion reaction. Blood, now here this sentence you see, blood transfusion has undoubted benefits, but some adverse effects do occur in spite of all relevant tests, and they are commonly called blood transfusion reactions. So here, blood transfusion, definitely it will have the benefits, isn't it? So, but sometimes I told you that we will take all these donors' history, and then we will do the basic screening test, and we will do the cross-matching, major cross-matching, minor cross-matching, but still sometimes what happens, there will be the blood transfusion reactions will be there, understood here? So blood transfusion has undoubted benefits, definitely. We want to give blood to save a person, but some adverse effects do occur in spite of all relevant tests, and then they are commonly called blood transfusion reactions. So though we do different tests, we will do the this basic screening test, the 5 tests we will do, and then we will select the best donor or the healthy donor, but still sometimes there can be the blood transfusion reactions can be there, understood?
Yes, ma'am.
So here under the types of the blood transfusion reactions, so it comes under the 2 types. One is the hemolytic transfusion reaction, and another one is the non-hemolytic transfusion reaction. Hemolytic transfusion reaction means whenever the RBCs are lysed, that time, whenever the RBCs are lysed, that time, please mute your mic. So here I told you about the types of the transfusion reactions, isn't it? So it is of 2 types mainly. One is the hemolytic transfusion reaction, and another one is the non-hemolytic transfusion reaction. Under the hemolytic transfusion reaction, so here there is the lysis of the RBCs, that's why it is known as the hemolytic transfusion reaction. And under the non-hemolytic transfusion reaction, so there will not be the lysis of the blood, but there will be some, it will show some signs and symptoms and then irritation, so that is known as the non-hemolytic transfusion reaction, understood here? So this transfusion reaction is important. So it may be, we can ask you in the Viva also. Suppose we'll ask about the hemolytic transfusion reaction, what are the different transfusion reactions, but we will not directly ask this transfusion reaction. First we'll ask this, what are the different types of grouping, and then if you answer, then we will ask a little bit higher level questions, and then if somebody is good, then we'll ask this transfusion reaction. So that time you have to say that it is important, but this transfusion reaction is. So it is of 2 types. One is the hemolytic transfusion reaction, and another one is non-hemolytic transfusion reaction. So hemolytic means here, as the name tells, hemolytic transfusion reaction. So there will be the lysis of the RBCs, and another one is a non-hemolytic. There will not be the lysis of the RBCs. So now we'll come to the hemolytic transfusion reaction. So now here the hemolytic transfusion reactions will have these signs and symptoms. Suppose in which cases these hemolytic transfusion reactions occur. So there will be the burning sensation at the site of the injection. So there will be the burning sensation at the site of injection, means where we are transfusing this blood, at that site there will be the burning sensation will be there. The patient will tell that I will have this little bit burning sensation, or I will have irritation, like that they will say. And then the patient face will also be flushing, and then there can be also fever with chills, understood here? So flushing of the face, you can see on the face becomes red, and then there can be the fever, and there can also be the chill sometimes, means the patient will tell that I'm having or I'm feeling cold, understood here? So in case of the hemolytic transfusion reaction, there will be the pain in the back. So on the back side, the patient will complain of the pain, and there will be also the shortness of breath. So the patient will tell a history like I'm having difficulty in breathing. So it's leading to the, we are talking about the hemolytic transfusion reaction. So whenever there will hemolysis is there, there is the RBC rupture is there, isn't it? So that's why it will lead to the hypotension and then the shock. Understood here? Sometimes it can lead to the hypotension and then the shock. And under the hemolytic transfusion reactions, it can also lead to the disseminated intravascular coagulation, and sometimes this will lead to the acute renal failure, not the chronic renal failure, but acute renal failure. So under the hemolytic transfusion reactions, there can be the burning sensation or irritation at the site of the injection. At the site of injection means where the blood is flowing, that needle or the tube near where the needle is pricked for the blood transfusion. At that site, there will be the burning sensation, and there can be the flushing and fever. So patient will say, I'm having fever, I'm feeling warm. So flushing also will be there. In the face, you can make reddish will be there, and then it may be spreaded in the other areas also. And then the chills. So the patient will say that he or she is feeling cold, and pain in the back. They will also complain of the back pain, and they can also say the shortness of breathing. So if all these things are signs and symptoms, they will say, then we have to think of the blood transfusion reaction, and hypotension and shock also. And another one is the disseminated intravascular coagulation and acute renal failure. So because of this hemolysis, it can lead to the acute renal failure. So hemolytic transfusion reaction, this signs and symptoms understood. So when we will see all signs and symptoms like this, suppose blood is giving and then the patient is telling, I'm having back pain, or I'm having shortness of breathing, or I'm having this burning sensation at the site of the transfusing that needle pricked area. So we'll stop immediately the transfusion. Understood here? Now we can see the causes of the hemolytic transfusion reaction. So it may be because of the inadequate or the incorrect labeling of the blood. Inadequate or the incorrect labeling of the blood means, suppose in a ward there may be two patients. Suppose both the patients' name are like Ram. Understood here? Example only. So Ram. Suppose a doctor will say that, okay, give orange blood for Ram, and then the sister sometimes they will send the blood of another Ram, and whenever the blood was given, then cross matching will be there. So both the persons may not be having the same blood group, isn't it? So if some other person's blood goes to the same name person, then there can be this hemolytic transfusion reaction. So inadequate and then incorrect labeling of the blood. So here sometimes it can occur an improper identification of the patient, either at the time of sample collection or in case of the transfusion of the blood. So this example also I gave you. And then errors in blood grouping. Sometimes if a blood, there will be this hundreds and hundreds of blood, and so much precaution we have to take that if A blood group, it is written as the B blood group, then there can be error, isn't it? So all these things will lead to the hemolytic transfusion reaction. And incompatibility not detected in cross matching. Sometimes I told you we will do the cross matching. One is the major cross matching and another one is the minor cross matching. So if it is not done properly, so sometimes minor clumping of the blood or agglutination of the blood, if we miss that, then it will lead to the hemolytic transfusion reaction. And sometimes what happens, there will be the failure to detect the weak antibodies. So weak antibodies will not be detected easily. So that time also it can lead to the hemolytic transfusion reaction. So inadequate or the correct labeling of the blood means, suppose the labeling of the blood can be mistake also. Inadequate or the incorrect labeling of the blood. And improper identification of the patient, either at the time of sample collection or at the time of the transfusion reaction. So blood bank is a very sensitive place. So, and then the transfusion, one has to be very careful. Usually patient party or the patient will come to know that, okay, I didn't have shortness of breath or I didn't have all these things, but after transfusion the patient died. Like that they will complain. So it may be because of the hemolytic transfusion reaction and errors in the blood grouping. So I already told you there can be errors in the blood grouping. If A blood group is written as the B blood group, and incompatibility not detecting in the cross matching means, so here sometimes there may be the minor clotting, and if a person sees with the naked eye and if he doesn't check under the microscope, that time there will be the incompatibility which is not detected during the cross matching. So that time also this hemolytic transfusion reaction can occur, and failure to detect the weak antibodies also. So now we'll come to the non-hemolytic transfusion reaction. So hemolytic is finished. So we'll come to the non-hemolytic transfusion reaction. So under the non-hemolytic transfusion reactions, it can be classified as febrile non-hemolytic transfusion reaction. So febrile means so only the fever will be there. So febrile non-hemolytic transfusion reaction can be there, or there can be the urticarial transfusion reaction. So there can be just allergy only. So urticarial or the allergic transfusion reaction can be there. And sometimes there can be the anaphylactic transfusion reaction can be there. So anaphylactic means because of the allergic, there can be the anaphylactic transfusion reaction can be there. So all these things comes under the non-hemolytic transfusion reaction. And another one is the non-cardiogenic pulmonary edema. So there can be the pulmonary edema can be there because of this transfusion. So that is known as the non-cardiogenic pulmonary edema. And then there will be the circulatory overload also. Suppose blood has to be transfused to the recipient. We will not transfuse the whole of the blood within 1 hour, understood here? It has to be slowly transfused. Usually whenever it is not necessary, we transfuse that 1 pint of blood in 4 hours. So there will be the no circulatory overload will be there. Suppose if a person has to receive the 3 pint of blood, and if somebody with the negligence, that blood is all 3 pint, it is transfused within a short period of time like 2-3 hours, then there can be the circulatory overload will be there. So it has to be transfused slowly, drop by drop. And 1 pint, it has usually we will finish by 4 hours or 3 hours, understood here? So circulatory overload. And then there can also be the under non-hemolytic transfusion reaction, there will be the graft versus host disease. So graft versus host disease means you just have to know the name only, but still I'm explaining to you graft versus host disease, because if suppose kid is having the blood loss, or kid requires the, or children requires the blood transfusion. So the parents, they are always ready to give transfusion, isn't it? So they are always ready to help their children, isn't it? So at that time, if the parents, they will give the blood. Usually we don't take the blood from the own relative. So if the parent give the blood, then that time there can be the graft versus host disease. So that is the main cause. So under non-hemolytic transfusion reaction, it can be classified as the febrile non-hemolytic transfusion reaction. So here the fever will be there, febrile non-hemolytic transfusion reaction. Another one is urticarial or the allergic transfusion reaction. And the third one, you see, anaphylactic transfusion reaction. So much allergy is there, so it can lead to the anaphylactic reaction. That is the anaphylactic transfusion reaction. And non-cardiogenic pulmonary edema. So here the pulmonary edema will be there, and then the patient will tell that I'm having difficulty in breathing. So sometimes I told you circulatory overload also. If a blood is transfused immediately within a short period of time, it will lead to the circulatory overload. And graft versus host disease, I told you if the parents give blood to the offsprings, this or the siblings, then that time there can be the graft versus host disease. So now measures to be taken. I think this is around last slide. So what measures? So what measures we should take whenever there is a transfusion reaction? Are you understanding?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
So now you'll come to the clinical side, and then you'll be there in the ward, and then you'll be there in the ICU and all, isn't it? So all the time sisters may not know all these things, so at that time you have to be a little bit alert, and so you have to take these steps. So measures to be taken in any suspected transfusion reaction. So whenever there is any suspected transfusion, suppose if the patient is telling I'm having fever, or if you see flushing of the face or the redness in the neck or in the face, and then if patient is having I'm having chills, so, or even sometimes usually they say the irritation or redness at the site of the prick, that needle prick area, so immediately this transfusion should be stopped. Understood here? So stop transfusion, and then keep IV line open with the normal saline. So we will remove the blood transfusion, but we will keep the IV line open, and we can give the normal saline. Understood here? And then you have to inform the attending physician or the blood bank. So blood is stopped giving, isn't it? So here we have to inform to the one has to inform to the attending physician, so he or she can come, and also to the blood bank, because blood bank has issued the blood. So we'll inform the blood bank also, and check all the labels, forms, and identity of the patient to determine that the patient received the correct unit of the blood sent from the blood bank. So here we have to see, we have to check the label. Last time, few months back also, one patient party has to come for receiving the blood, and then that bag was ready. So the person who has to come 2 hours later came 2 hours earlier. So without checking the person, this blood bank staff, they gave the blood, and then within 5 minutes only that patient had this transfusion reaction. So we have to take action to the person, that person's. So you see here, we have to check the levels, forms, and identity of the patient to determine that the patient received the correct unit of the blood sent from the blood bank. So that also, all these things we have to see. So stop transfusion, keep IV line open with the normal saline. So we have to stop, and then after stopping the blood, that blood has to be stored or sent in the blood bank for the storing also. So we have to keep IV line open with normal saline, and then we have to inform the attending physician and blood bank. So attending physician, he can come and see, is it because of the blood bank blood or because of other things, and then the blood bank also has to be informed, so that they will have all the record, and they will check whether the exact cross-match blood is sent or not. And we can see also check all the labels, forms, and identity of the patient to determine that the patient has received the correct unit of the blood sent from the blood bank. Clear? Did you understand this much? Now, this may be asked usually we don't do this universal donor or the universal recipient, but still you should know this, which blood group is known as the universal donor and which blood group is known as the universal recipient. So donor, blood group O negative. So here in case of the blood group O, there is no antigen also on the surface, and it is also no D antigen also, isn't it? So the universal donor is the blood group O negative, and universal recipient, it is the AB blood group, that is the AB positive. Understood here? So sometimes somebody may ask like, which blood group is this one universal donor, and which blood group is universal recipient? That time universal donor is the O negative and universal recipient is the AB positive. Your class is finished. You have any questions?
Excuse me.
Yes, please.
In febrile non-hemolytic transfusion reaction,
Mm-hmm.
it is caused by the release of inflammatory chemicals from the donor leukocyte or the recipient.
Actually, febrile, not from the recipient, but sometimes there can be the weak antibodies. Suppose if a person is sick and he or she has received several units of the blood, then some these antibodies or these weak antibodies, it may be there in the recipient also. Usually, healthy donor sometimes occasionally only, because we will ask all these questions, isn't it? So how to select the donor, I told you. So there can be some mistakes sometimes. So it can be from the both side.
Yes, ma'am. And in hemolytic reactions.
Yes, please.
And in hemolytic reactions.
And in hemolytic reactions, what we should do?
Yes, ma'am.
Actually, in case of the hemolytic reactions, we suppose if a patient will say they can say any signs and symptoms, like they can say that, okay, I'm having flushing, I'm having irritation, I'm having that fever, chills, anything they can say. So at that time, we'll immediately stop the blood, and then usually they will say, they will not say after 1 hour, 2 hours, understood here? This hemolytic transfusion reaction, it will occur immediately. So at that time we will stop the blood, and then we will send the blood to the blood bank, and we will ask whether that is the same, and the patient blood will also be there for cross matching. We'll again do the cross matching of the blood, and we will do the grouping of the blood, and then if the patient still is having some signs and symptoms, the patient's blood can be taken. We can take the new blood from the patient, and we will see whether there is any hemolysis in the RBCs or not. We will examine whether his hemoglobin is reduced, or his in the peripheral smear. You know the meaning of cystocytes? Cystocytes in anemia you must have studied, isn't it? So that is the broken RBC. If the RBC is broken, then, and it has got something like tail on its broken part, and we will see further if there is any lysis of the RBCs under the microscope in the peripheral smear. Anything?
Yes, ma'am.
Anybody?
Thank you, ma'am.
You are always welcome. Anybody wants to ask anything?
Ma'am,
Yes, please.
when frozen plasma
Yes.
is transfused from measles cured person who have lifelong immunity against it, will the recipient to get the lifelong immunity or not?
What did you say?
Ma'am, when the frozen plasma is transfused from the measles cured person who have lifelong immunity against, will the recipient to get the lifelong immunity or not?
No. Suppose immunoglobulins will be there, isn't it? So that is just fresh frozen plasma is very less amount, 30 ml. Like that, it is not tested. That part I don't know, but usually that we will not talk about the immunity here, because here we will give the fresh frozen plasma in case of the bleeding persons, isn't it? So here, whenever there are the different regions, whenever the prolonged surgery is going, or whenever bleeding persons, at that time we'll give the fresh frozen plasma for stopping the blood. But that immunity thing, whether it will be there in case of everybody will receive the measles vaccination, isn't it? So nowadays it's not like old age, like the stone age, the person has not received the measles vaccination. So measles vaccination is given in the child only. So that time, I'm not sure about whether this measles vaccination, which has measles immunoglobulin, which has gone from the donor to the recipient, will give lifelong immunity, because the person who has received who is receiving that fresh frozen plasma must have received. No, nowadays, will there be anybody who hasn't received vaccination? I think so.
Yes.
We are giving that fresh frozen plasma to stop the bleeding, not for the immunization. Any more questions?
Okay.
Okay, thank you for asking. Yes?
Why cross-match is required when a blood is transfused from a donor to recipient having same blood group?
Because you see here, I told you about the Bombay blood group also, isn't it so? So at that time, H antigen is not there, but that person's blood group will be seen as O blood group, isn't it so? But can he receive any blood from other persons? He has to receive the mumbaI blood group for that person. And so this is a rare condition, isn't it? So sometimes what happens, usually a donor will be healthy and will screen, and then we'll ask every history, whether patient is having any, this one wound infection is there or not, any vaccination given is there, or whether antibiotic taken or not. So we'll ask all this history. But still sometimes what happens, the sick person can have this some immunoglobulins and then antibodies in their body. So whenever we will do the cross matching, though the same blood group is given, some B blood group or the B positive person's recipient requires the blood, and then the B blood group one blood is tested. That time it will show the clumping, but to the another one it may not show the clumping. That's why the this cross matching, major cross matching, and then the minor cross matching is very important. Without cross matching, we will not give the blood at all. Understood?
Yes, ma'am. Thank you, ma'am.
You're always welcome, dear. So blood banking or this transfusion medicine is interesting, but still there are a lot of things, and usually issues are there because patient party will immediately come to know that, oh, this my patient died because of this after transfusion also. So with the medicines and all, they may not know, but whenever blood is given, it will show the immediate reaction. So anaphylactic shock and shock, everything they also immediately show. The patient party will do, and then they can break somebody's bone, and then these glasses and all also. Any more? Okay, today's class is finished. Actually, today was actually the class for practical blood grouping. So my class yesterday I could not finish, and maybe Dr. Sudeep will take your practical blood grouping and other instruments and little bit of the cards next time. So thank you for listening, and thank you for coming.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Okay.